Welcome to another program in our series, the DFL Senior Roundtable. I'm Bill Weir, and it's a pleasure today to welcome Dwayne King and Don Bankhart with our special guest, Robert Shumer. Robert, welcome.
Thank you very much.
And we're looking forward to your presentation on seniors, citizenship, service, continuing to make democracy work.
Thanks very much.
We've just been through a general election, and we need to know.
Okay, it will be my pleasure. My name is Robert Shumer, and it's a pleasure to be here. I'd like to just give you a brief background piece on me. I am currently a research fellow at Clemson University. I teach a course on principles of civic engagement at Metropolitan State University here in the Twin Cities. I was formerly involved with the University of Minnesota. I was the director of the National Service Learning Clearinghouse for many years and have done a lot of research on service learning and civic engagement, and am actually currently involved in teaching some courses in Asia. In Beijing, I just am teaching a class on service learning and evaluation, and was just involved in teaching a course in Hong Kong on a similar subject. And so I spent almost 50 years involved in education, trying to connect academic programs with community. And so what I'd like to talk about today is an important area related to how education and democracy are connected, because I think we have some obvious challenges in our country today. And so I'd like to go through my formal presentation, the PowerPoint, to highlight a few things about seniors. I'm going to be 70 years old, so I think that qualifies me to be part of the senior community.
Oh, yes, indeed.
Oh, yes, and sometimes I like to think of myself as still having the energy of when I was 15 or 20, and so maybe that helps to connect me with young people. But I really believe, and we'll talk about some programs where connecting young people and seniors is probably the greatest thing that we can do to promote democracy and to ensure our future. So let me start with the PowerPoint, and then we can engage in some conversation about the critical issues.
So becoming a senior is a matter of luck.
Yeah, you want to do the
Next.
next?
Next.
Yeah, okay. Okay,
Next.
okay, we'll try. It's not advancing. There we
There we go.
Okay. I show this slide. I actually used it in a presentation that I gave in Singapore to talk about the fact that all of us are lucky to be alive. In many parts of the world, as you can see from these images, there are children who are starving to death, who are literally skin and bones. And we don't often talk about the fact that 18,000 children die every day, or that 5 or 6 million die every year. But that's a concern. And so in a way, as seniors, we're lucky that we're not in parts of the world where children don't survive to the age of 5. Next. What I'd like to do is just to share a little bit about the senior world from World Bank estimates, and the fact that seniors in 1960 comprised 5% of the world's population, and today it's grown to 8%.
That's quite a bit larger.
That's, even though it's a 3% gain, it's a lot of people. And also to show you that seniors have actually acquired quite a bit of wealth during the time period, from 9 to 17%. And then in fact, in the least developed countries, it's still relatively low at just 4%. And the United States has grown to show that our senior population is close to 15%. And in Minnesota today, it was 12.9% in 2010, and now is closer to 14%. So senior populations are growing. Next. In terms of seniors related to civic participation, Minnesota, as usual, has led the country in voter participation. Unfortunately, it was down. 2008, it was 78%, 2012, 76%, and in the recent election was down to 74%. Yet that's still the highest among all of the states in the country. That says a lot about our democracy in terms of being concerned, because in essence, as we found out in the last election, almost half of the population didn't vote. And so to talk about a democracy where majority rules, we have a real civic challenge to live in a country where half of the population does not participate in the electoral process. And nationally, the good news for seniors is that we represent the highest group, age group, 65 to 74, that votes, 78%. And that unfortunately the lowest percentages are the young people, 58% of the 18 to 24-year-olds, and those without a high school diploma are just 50%.
Almost half not voting.
Almost half not voting. It's one of the challenges of the dropout issue. I didn't mention that I'm a research fellow at Clemson with the National Dropout Prevention Network, and one of the major concerns about high school dropouts is they do not participate in civic life. The highest voting percentage, 89 or 81.9%, comes from those in the middle to upper middle income areas. And so that's an important thing. So the people who have a major interest financially, lower income people, are not as involved in the civic process. Next. And we've had historical trends in relationship to seniors. In 2008, they supported a senior candidate, John McCain, over Barack Obama by about 8%. And research has also shown that women tend to identify themselves more with the Democratic Party and more than independents. And women's issues of abortion and health care have the potential to engage more women to vote for Democratic rather than Republican candidates. Next. My concern with the presentation today is really to talk about the role of citizens in democracy. Not a Republican issue, not a Democratic issue, but an issue of citizen responsibility. And citizens are supposed to not only elect their leaders, but participate in all phases of life. As the slide shows, from family and work, social interaction, and to framing the values and the moral environment of our culture. Next. As an educator, one of the most important books written on this topic was written by philosopher John Dewey, who wrote about democracy in education.
This one, yeah.
Which is, can you see this? Anyhow, in Democracy in Education, Dewey talks about the role of formal and informal education and the need that young people have to connect the real world with learning theories and ideals, and that young children develop from immaturity to maturity, from basic knowledge, learning from experience, to knowledge that's informed from both experience and study. Next. One of the basic things that we talk about when we're talking about education is talking about how do we learn. And we learn lots of ways. We learn by studying subjects in schools. We learned in our early years by experience. We listen to our parents. We listen to peers and elders. Basically, we reflect on our life experiences to try to understand how to connect academic subjects like civic education and social studies with our life. And we need to continuously reflect as lifelong learners on our own growth and our own development. Next. One of the important things that Dewey talks about is that the development of young people is really a transmission of culture. And it occurs, as the slide says, by communicating habits of doing, thinking, and feeling from older to the younger. That means that seniors have an important responsibility to share the process of learning, the process of becoming a mature adult with young people.
So not simply the school teachers, but seniors need to be involved in.
Right. Everybody, as we'll talk about later, everybody who's part of the community needs to share. Just as young people will share with seniors information. As an example, young people today are much more knowledgeable about technology and using their cell phone than most seniors. And so we have a way of learning from one another. And schools serve only part of the social transmission. They're the ones that have to be connected with real life and engage young people in civic practice. Next. One of the books that I use in my Principles of Civic Engagement course is called Soul of a Citizen by Paul Loeb. Loeb has been involved in civic issues for a long time. He recently, in this election, was working on trying to engage more than 500 universities around the country to get students involved in the electoral process. And in Loeb's book, Soul of a Citizen, he talks about the fact that the way to become a citizen is to be engaged, to be involved in civic action. So he, like Dewey, says that we have to connect experience with theories. We have to be involved in real life process. It's not something that you just read in a book. He also suggests that the civic process, as a third item suggests, is not always successful. That sometimes young people, when they try to make social change or they try to get engaged and they're not successful, they get depressed and they stop trying. And so what Loeb says is we need to continue to realize that you don't always have to be successful. And in his book, he talks about people like Martin Luther King. He talks about Gandhi, who all had failures early in their lives. We don't think of them as failures, but they did have failures. And so we need to learn how to overcome failure and continue to move. Loeb has identified what he calls 10 principles of civic engagement. Next. And in these 10 commandments, as I call them, he gives you an idea of what you have to do to be an engaged citizen. And the reality is you start where you are. No matter what situations are, you have to start where you are today with the situations as they exist. You have to plan things step by step, and you have to build community. And in building community, you have to be strategic and also enlist the uninvolved. So from our data that I presented earlier, the least involved in the electoral process in citizenship are people who drop out of school, who drop out of high school. So one of the things that we might do as seniors is to begin to think about how could we develop programs that would help young people to stay in school and to learn the civic process as part of their education. Next. The next 5 commandments start with seeking out unlikely allies. In a democracy, we have to promote community, and community means we involve everyone. And sometimes that means that seniors have to reach out to younger people, that Democrats have to reach out to Republicans, to independents, that we have to find some common issues, common principles that bring us together, because that's the way we get stronger as a community and as a nation, is by seeing that everyone has something to contribute, something to help make our communities better. We have to persevere. Life isn't always helpful and successful, and you have to savor the journey. You have to understand that the ups and downs are part of life, and that you have to think large and not lose the visions that you have about what it is to be a good person, what it is to have a good society. And most importantly, you have to listen to your heart. We have lots of research to suggest, and Thomas Friedman in his book, The World is Flat, I don't have the book here, but he has this formula that suggests that CQ plus PQ is greater than IQ. And that means that the curiosity quotient plus the passion quotient is greater than intelligence. And it's passion that drives civic action. And so we need to find the things that make people passionate about change and about community. And that's how we get people involved in the civic process. Next. Another part that we need to understand is the role of service. And service, and I'll show you in just a few seconds, is really a critical element of greatness. We know the quote about Martin Luther King when he said, "Everyone can be great because everyone can serve." And one of the areas that I've been involved with in the civic process has been service learning, where we combine service and learning to help engage young people in community issues and help them to learn the academic content of the subjects that we traditionally teach as they address the community issues that they need to resolve. And so it's service learning is a movement that has involved people in schools from all over the United States. And as I'd mentioned, I've been spending a lot of time in Asia. In Beijing, we have programs on civic service education for young people. In Hong Kong, we have service programs. Singapore, all over the country. In Europe, South America, service learning is expanding as a mechanism to try to teach young people to engage in civic action as part of being a servant. Next. And the importance of service has been represented in lots of religious philosophies. I'm not promoting any particular religion, but I do want to call your attention to the words of Jesus in the background of Christianity when he talked about the fact that we had a new norm of greatness. And he said, if you want to be important, that was wonderful. If you want to be recognized, that was wonderful. But if you wanted to be great, that was wonderful. But you needed to recognize that the greatest among us are those people who serve, not the wealthiest, not the strongest, not the most influential. So part of our goal in service and civic involvement is to make that connection and to help people to understand that being a servant is the most critical and the most important part of our work in a democracy. And this concept, next, is not only found in Christianity and in the United States, but in other parts of the world. Next. A lot of the work that I've been doing in China, talking about service learning, is to help them realize that Confucius, who lived a long time ago, had 5 principles of ethical behavior that actually were like service learning. And one of his first goals was to create a society where people lived in harmony, where they got along. And that the purpose of learning over your lifetime was to gain wisdom, not just knowledge, but how to use knowledge. That other Asian religions, like Buddhism, are about trying to reduce suffering in society, and in Judaism, to serve others, to help the poor and those who suffer. And so there's a strong religious base in terms of saying that being a servant, helping other people, is one of the most critical elements of participation in community. Coupled with that is what we know about how we learn. Next. You may have all seen the learning pyramid. It's been around for a long time. But it's important to realize that just listening to a lecture doesn't allow us very much effort to actually learn something. We don't retain things. As you go down the pyramid, you'll see that the most effective ways of retaining knowledge are by discussing 50%, practicing by doing 75%, and 90% teaching others and using knowledge. And so what we need to do is to create environments where we get to teach one another. That's the way that we retain information and we get to understand how to learn. Next. So the important part about the civic education process is to be able to connect academic learning with service and character development. And the best way to do that is to work through projects, to develop things in our communities and our country that help to connect people to change things for the better. And in fact, there's a program in Singapore called Values in Action. And it's all about trying to practice the things that we think are important, like respect and responsibility, caring, honesty, sharing, These are the values that bring us together as a community. And so we need to make the world better and learn at the same time. Next. There's a simple recipe of steps that you take in order to accomplish this. The first thing to do is to determine your community need. We need to sit down with seniors, with other people in the community and say, what do you want to address? What are the issues? How do we involve people in the solutions to these problems? And then the second step is to develop a plan, a program. What are we going to do to improve the conditions? What do we need to know in order to understand those issues? And then we reflect as we begin to implement the program. And the third step is obviously to evaluate what's happening. What are we learning? What actions are we taking that are making change? And so I'll talk about the environment in a few minutes, but if we use the environmental issue, if air quality is an important consideration, then how do we understand what the problems are that create the issues of air quality and pollution, and how do we develop the measures that will show that we're making progress? And so that third step is to evaluate our learning and our actions, which lead to the fourth step, which tells us whether or not we're being successful or whether or not we need to change our approaches in order to move on. And so as you can see, the four process areas on the picture are to act, to plan, to check, and then to do. Next. So if we put all of these things together, what's important for seniors is to realize is that we need to make sure that we connect with younger people. We have to find common areas of interest. We need to work on all of the areas, social, political, and personal actions. And we have to, most importantly, build sustainable systems. Not something that just starts for a couple of weeks, but something that happens over a period of years. Next. One of the reasons I'm here is because of a program that I started a few years ago called Senior, Senior, Senior. And that's where I met Bill Weir. And the idea behind Senior, Senior, Senior was that we needed to connect senior citizens with seniors in college and seniors in high school. And our goal was really to start civic engagement clubs in the high schools and have them supported by adults and by other mentors, both the college students and the senior citizens, to begin to address the issues of young people. And we could use those people to mobilize human and fiscal resources. Senior citizens come with an abundant knowledge of community, foundations, people and organizations. College students come with knowledge about service learning programs, about how political science students can be involved, how economic students can be involved, how communication students can be involved, and most importantly, how high school students who are beginning to become adults can use their resources in order to get communities built so that they can actually make change. And so part of the fundamental shift that we're talking about is, as a person who's getting older, and many of you who will be watching this are older, realize that there's a lot more energy in young people than many of us have. And so we need to harness their energy. We need to work with them to share our wisdom and our knowledge so that we can actually create the kinds of environments that will result in real change. So one of the areas next that I just call your attention to is the environmental issue. As somebody who just came back from Beijing, China 3 weeks ago, I can tell you that air pollution in Beijing is horrible. People walk around wearing masks. The pollution has a major effect on health. The life expectancy in northern China is 10 years less than in southern China because of the burning of coal and the level of pollution. As a young person who grew up in Los Angeles, I can tell you personally of what smog means. I, at 18, played golf, and I could not finish 18 holes of golf because I could not breathe. That's a reality of air pollution. It's something that we need to be able to share with other people. Young people need to learn, as they study the concept of environment, to learn how to recycle. How do we make wise use of energy? How do we use solar energy? Many of the European countries are well ahead of us in terms of mastering and controlling solar power, and reducing the kinds of pollution that come from burning coal. And so we need to create those kinds of environments so that kids study these issues. So one of the critical things that I'm hoping to share with you is that democracy depends not just on participation and voting, it depends on education. It depends on having people who are knowledgeable about subjects. So when they cast their vote, it's based on something other just than a whim or an impulse. It's based on ideas. And so seniors need to help bring that experience to the process. They need to bring the ideas. They need to bring resources. They need to connect with young people, because the research in youth development suggests that young people are successful when they have some meaningful adult in their life who can help and care about them and provide them with some guidance. And so that's what we need to do. Next. An issue that's near and dear to seniors is Social Security. And I have done a little research and suggest from that research that 9 out of 10 individuals age 65 receive Social Security benefits. And for about a third of that population, those benefits represent a third of their income. And so Social Security is very important to the senior community. Next. And you get into more of the data, you'll find out that 48% of married couples and 71% of unmarried people receive more than half of their income from Social Security. And it gets even more critical when you talk about 21% of married couples and 43% who receive 90% of their income. So income is very important to seniors as they talk about Social Security and its support. But young people also need to know that 13% of the Social Security funds go to deceased children of deceased recipients. So Social Security isn't just about young people, or just about old people, it's about young people, that there are young people who are benefiting. And so part of our combined effort to work on maintaining Social Security is to have young people and seniors understand that they're both in it together, that we have a common bond. Next. And so as we begin to show them that young people are benefiting from Social Security, that we have this mutual interest, that we need to develop a system that helps young people to understand that they help to pay the support for Social Security because they're paying it forward. That in fact, everyone benefits. That seniors can work with children, young people, and suggest, we have been paying for your education. You didn't have to pay for your education, and so we have been working with you to support you, and we're asking for you to help us to support Social Security. When people find that they have mutual benefit and mutual concern, they're more likely to work together. So having presented, next, what I hope is a fairly strong argument that we need to get seniors working with young people and that we need to participate in finding common issues to work together. I'd like to ask the three gentlemen who are here at the table to begin to talk about what they think are the top 2 issues that seniors need to be concerned about and how we might begin to engage young people in solving those problems. So Don, maybe you can start?
Thank you. I consider, from my experience so far, is that 2 very big issues coming up. I wrote them down. Pharmaceuticals and the cost of medications, and of course this affects everybody all the way across.
Yes.
I know there are young people that have to go to school, well, with the EpiPen in their backpack. Mm-hmm. And this has gone some 500% more expensive. Now the national news just the other night was going through a whole list of medications now that are going up 100, 200, 300%. I, as well as being a senior, am involved with a little bit of the disabled community. and I see these people on limited and fixed incomes panicking over what's going to happen, what choices they're going to have to make between having the drugs they need or being able to eat and pay their housing costs. And I think, yes, we need to get the young people involved in thinking about that. Another big one that's come up is transportation. We see a lot of arguments that, well, you know, we don't want light rail, we have cars. Okay, you want us 80-year-old seniors with bad eyesight driving down the freeway with you? When we could take a car and go downtown, we could get on the light rail and go downtown. Good transportation, we've learned, other places, other parts of the country have learned that good transportation systems tend to draw the combined communities, senior high-rises, apartment buildings, people that don't want to drive are drawn closer to those light rail systems. And yet we seem to think that, well, that's very expensive. We don't want to invest in that. We're going to have, in the next 20 years, some major traffic jams if we don't figure out how to get people off the road. And this goes right back to your question, your statement about our environmental position, or pollution, pardon me.
But you raise in those two topics one of the fundamental challenges for everyone in the 21st century, and that is the impact of technology. Because young people will say, well, for those seniors who are 80 who have bad eyesight, in a few years there will be self-driving cars. So they won't have to see anything. The car will drive itself. And so one of the things that we have been impacted by is the role of technology and how it's affected the labor market, how it's affected the future of work. So in my background in terms of studying career and technical education, we talk about the fact that many jobs that will exist 20 years from now haven't even been invented yet. And those of us that are older can remember when we had a transistor radio, or we had something that called a telephone, and it actually hung on the wall. And so young people's experience today with technology is something that we as seniors need to understand and to work together. And that's where the wisdom comes in. Is it worth developing self-driving cars if we're going to eliminate all of the taxi drivers in the country? What's the impact? So this goes back to the service learning notion of academic study. So when we're talking about transportation, there are issues of economics. There are issues of sociology and culture. Again, having grown up in Los Angeles where we didn't have public transportation, everybody was dependent on cars. And having cars creates different ways of socializing. So you can have suburbs and people can drive in. But we didn't pay attention to the fact that all of that driving had an impact on the quality of the air. And so we need to combine the topics that you addressed, transportation, pharmaceuticals, the same situation. Young people need to understand the economics of developing drugs. There's a very expensive research component that pharmaceutical companies will tell us is important. And yet we also need to understand that the United States and only one other country allow for pharmaceutical companies to advertise their drugs on television. And so we need to have young people studying the issue of pharmaceuticals and drugs, not just from a gut level feeling that, gee, the cost went up, but what are the economic concepts behind this? What are the business concepts about producing and distributing drugs? What are the issues from the healthcare industry? Because one of the things that we haven't talked about a lot in relationship to the Affordable Care Act was the number of people who died who didn't have health care several years ago, and the fact that the number of people who are now covered has increased. And so what's the value of human life? That hasn't really been part of the conversation. Has the number of people who have been dying because of lack of health care gone down because of the Affordable Care Act? So that's where the academic studying component of citizenship needs to be brought in, so that we can learn along with young people about those topics.
And
What do
Dwayne?
Well, I think that health care is the #1 issue for seniors. That's under the premise that you can't do anything if you're dead. And so I rate that #1 across the board, and I support a single payer system. The second one I would rank is Social Security, because that thing, it's nice and easy to say that it's income and let it go at that, but it's really tied to other aspects of senior life, such as staying in your home, which most
Right.
seniors want to
Prefer.
do. And in order to be able to afford to do that, you can't have anything go wrong with Social Security. We've already seen how much people depend on that. And so I think that efforts to privatize Social Security, which really means kill it, because if you lose money in the stock market, you don't get it back. And so privatizing it really means killing it, as does means testing it, because then you divide the population in terms of their thinking about it, who's going to pay into something they know they will never get back out again. And so those two issues rank quite high on my agenda, but also they're the top 2 of the DFL Senior Caucus.
Okay. And those are important issues to bring up, because in many parts of the world, we talk about how can we create opportunities for young people to connect with seniors. For example, in Singapore, there's a tax subsidy for children who live near their parents, because the belief is if you live near your parents, you'll go visit your parents and you'll help take care of your parents, and that will reduce the social cost of actually maintaining support for seniors. And so we could talk about how could we get college students who are studying gerontology, or high school students who are trying to understand the world of their grandparents, to actually visit some seniors and to help them to deal with their issues of eating healthy food or getting transportation. And so the question related to service is, how can we provide service from young people to deal with the issues that you've raised, and at the same time help those young people to understand what the world looks like from a senior's perspective?
Well, I failed to additionally mention, when I mentioned healthcare, I don't have that concern selfishly for myself or even selfishly for seniors. I have 4 sons, 3 of which are independent contractors, and therefore they're in a precarious position in terms of health care costs and in terms of the coverage that they really should have. And so this extends to my children and my grandchildren.
Right.
And so I agree with you that it's really important that we make them understand how much of a stake they have in this whole thing as well. Not only that, they're told they won't get Social Security, but in fact, if nothing happened at all in Social Security, they get 70% of their benefits. That's not nothing.
Right.
So I'm all about trying to make younger people know that we're all in this together. We need to support each other in those 2 areas in particular.
Sure, and that and that's the reason that I suggest we need to drive it into the educational arena. That when we talk about Social Security and we talk about Medicare, when we talk about the cost of drugs, those are all interconnected. So we have a donut hole. We have politicians who have attempted to address some of those issues. And so when we talk about, from Paul Loeb's perspective, that we need to bring in some allies that are not ones that we would typically think about, that might mean that we should bring in the pharmaceutical industry and to say, you need to come to the table. Because our goal, getting back to the principles that we believe in, that everybody in the United States believes in, is that we should support our grandparents. we want them to have a healthy and a high quality life. There's nobody who really would come out and say, you know, I just would like to see my grandmother die or my grandfather die. But if that's the common thing that we believe, we want to sustain life and we want high quality life, then we need the pharmaceutical companies to come to us and say, what are your challenges? How do we bring the costs down so that pharmaceuticals are affordable? We know that they're very expensive in the United States, far less expensive than the rest in the world. So why is it cheaper in other countries than it is in the United States? And let's have an honest dialogue. We're not trying to cut your profits so that you'll go out of business. But at the same time, you need to realize that the high cost of pharmaceuticals literally kills people in the United States and in other parts of the world. And we don't think that you intentionally want to make money at the expense of somebody else's life. And so those people who are pro-life, they need to be engaged in this discussion, because if you believe the life of the fetus is important, you probably also believe that the life of somebody who was born and somebody who is 70 and somebody who is 85 should be equally important. And so they need to come to the table. And we need to have the students helping us to understand what are the real subject matter, the academic components, what are the theories, what are the economics involved in all of these decisions, so that we can come together. As Dewey was saying, education and democracy are intimately connected. You can't have one without the other. And so we need to develop a much better educated electorate so that our conversations are much more substantive about the content about these issues instead of the emotions.
And I think the terms that we use, we sometimes don't think about their actual meaning, and it's something that we really need to pay attention to in healthcare. We continue to talk about the high cost of healthcare. We don't know what the cost actually is. We know what the price is. We know what the price is that we pay. But you mentioned we have to understand the economics to find out exactly what is the cost of healthcare, and I believe it's a lot lower than the price we pay in the United States, and you've alluded to that.
Or just understanding the relationship of Medicare, for example, with services provided. So when somebody like Health Partners bills for an operation, they bill Medicare for a certain expense, and yet their cost, as you suggest, might have been much less than that. And so we don't know quite what the costs are, or there are certain political agendas on the part of people about having private people make consumer decisions, that the most efficient systems are market driven. And so we need patients to make decisions about the kind of health care they're getting. And other people who are saying, do we have knowledge and research to show that the average person knows the difference in price between an MRI and a CAT scan, and whether or not an MRI is appropriate for their kidney cancer, or whether or not some other program is more acceptable. And so we need to get those issues on the table so that it becomes a study of what are the theories and the concepts that we need to look at in order to understand whether or not consumers can make decisions related to healthcare, or whether or not there are other programs that suggest that people need to rely on experts to help us to bring the cost down, and at the same time to be fair to pharmaceutical companies to say, yes, you can make a fair profit and sustain your work without killing other people in the process.
So if my appendix bursts, I should shop around for the most reasonable doctor in the marketplace before it gets taken care of.
No.
I kind of don't trust the marketplace in healthcare.
Right, you want to get something immediate in care.
Well, the more realistic problem would be you would be dying in the ambulance on your way to the hospital as you're making your phone calls to find out which hospital to go to. I mean, those are some of the obvious issues that suggest that there are certain things related to healthcare that go beyond market. And that's why the community needs to be involved in making those decisions beforehand, so that you don't have to be in that situation.
Yeah, yeah. You relate something very, very important to me is that 2 years ago, I had cancer. And I realized as I was going through this, I thought it was just me at first, but I realized just about everybody, unless they've got a medical background, suddenly becomes extremely dedicated or accepting of whatever their oncologist says, whatever the program they're going to put you on, whatever drugs they're going to have you take. And I went to a general room where I sat and got my IV treatments along with many, many other people. And we began, of course, talking about the price of drugs. I thought I was paying something at $439 a pill, 10 pills a week. When I found out the lady next to me, her first treatment for breast cancer was $18,000. But when you're scared and you're looking death in the face, you will pretty much accept whatever the doctor puts forward. So you're right. We need some people who can step back, who aren't scared, who aren't suddenly looking at life and death, and can sit and say, was that a reasonable choice? Are we being fair, or are we taking advantage of people?
Yeah.
Their absolute need of, I get this medication or I die.
And those are challenges. I had the personal experience that I have Crohn's disease, and have had it for 60 years. And a medication that the gastroenterologist wanted to use was very expensive. In fact, some of them are $1,800 for each infusion, as opposed to using prednisone, which costs about $3. And so we had a discussion, and over a period of several months came to the conclusion that my concern about the side effects of some of these expensive medications were enough to convince the doctor that we should perhaps modify it and go back to the prednisone, which was much cheaper, and in our collective decision didn't cause me any more real harm. But I think that I have some background in that area, again, having the disease for 60 years. A lot of people, as you have suggested, may not have the background to be able to engage in that kind of dialogue with the physician. But we need to get those kinds of discussions on the table so that people who have my illness can teach other young people about the disease, can work with physicians. So when we talk about building community, and that's really the focus, I hope, of this whole presentation, is that we need to bring together people, older people, younger people, allies like physicians, allies like the pharmaceutical industry, to say, let's have an honest conversation so that we can reach some kind of conclusion about policy that's going to help everybody feel like they've won something. And that's how you build community. And that's how democracies work. Democracy is based on trust. If you don't trust the other people in your community, you won't have a strong democratic system. So we need to reach out, and we need to put education and civic engagement on equal tables so that we can work together.
Well, you mentioned the 4 steps, I believe it was, in bringing a group together, and I thought that was really important, that sometimes we miss those other steps. In fact, you mentioned the 10 steps, but I thought the 4 steps was a good summary. The part about bringing in allies out of people you wouldn't normally expect, I think in the legislature, wasn't that kind of called getting all the stakeholders together?
Yes.
And working across the aisle.
Working across the aisle.
Yes. And I think that's very important that we as seniors involved in it take home and bring back to our groups and say, you know, yeah, it's great to say we have an issue, but we need to get together with all the stakeholders and find those allies that we wouldn't otherwise think of bringing in.
I think we can take a good example from the work of Senator Amy Klobuchar. She is notable for working across the aisle,
Mm-hmm.
and from State Senator Terry Bonoff, working in the Senate to unite the middle, as she says.
They're all very important, and sometimes I think we as seniors, when we bring together our groups, we need to say, okay, what are the issues? We can't possibly conquer everything immediately. We can't walk out the door here and a week from now have a formula for conquering every issue we brought forward. But gathering a few seniors together and then going back to our individual groups, our different caucuses, I can see where I could get together with the disabled caucus. And I think there's a whole family of groups that can address some of these issues. The pharmaceutical issue, the Medicare, Medicaid issues, all are affected. I think our problem seems to be from talking to people out in the community. They want something done, but they're not sure how to get it done. I have seen a lot of complaints on email. I bring up the transportation issue because I know a lot of disabled people who use public transportation, and now I'm hearing it from the seniors who have to use Metro Mobility. I'm waiting an hour and a half for my ride. One lady got stuck. She got a ride. She got to where she had to go a half hour early. It was great. She did her appointment, and then she waited 6 hours to be picked up.
6 hours. Wow.
6 hours.
There's something wrong with Metro Mobility.
And it's these kinds of issues. They complain, and they know that they can send the email to my wife or I, and we hear it. But we need, as you say, this education process.
And how to effectively
How to
correct the
effectively
problem.
bring it to the communities and then build the coalitions to say, this is unacceptable.
But one of the challenges that we face in the service learning world is that we need to develop relationships by mutual respect. What has changed the service learning approach is that in the past, when somebody did service, they were helping somebody who they thought was, poor and had problems, and they were being the savior kind of person. Whereas in service learning, we talk about mutual respect, so that when the woman talks about having to wait at Metro Mobility, you have to be respectful of her opinion and listen to her. And it's an interpersonal thing to make her feel respected. As we heard in this last election, there were some people in the electorate who didn't feel that their positions were respectfully heard by politicians. And so we need to have politicians who go out into community and to have public dialogue and have discussions like we're having here at the table to say, I believe that what you have to say is important, and I respect your right to say it, and I respect the fact that you have learned something from your life experience. Now, I can perhaps provide more information and dialogue if we're talking about adding the academics, adding subject matter, but we need to make people feel like they have a place at the table and what they have to say is heard. And that's probably the biggest challenge of developing a democracy, is to develop a respectful society so that people who have different opinions can work together and find some common bond. And it's finding that common bond that will help to strengthen our country. And I have in my final slide, maybe I should show that now and then we can finish the conversation.
Good. What's the next slide?
The last slide here is to talk about how we need to connect our schools and our youth and our elders and everybody to support learning that makes a difference, and we need to have everybody be a partner. And that young people, and part of our focus is on young people because they have longevity. If we're developing anything that's sustainable, it has to involve young people. because they're going to be here a long time, we won't. And they need to learn that in order to make a difference, that they have to reach out to their allies, to seniors, to people who have knowledge, so that they can become wise and not just knowledgeable. And so it is time, as I suggest at the bottom here, to work together. And we go back to our famous quote from Senator Wellstone, that we all do better when we all do better. And that is, we need to create a community where we're trying to all do better. And that when we do that, we'll in fact reach the outcome that we will all do better.
Well,
Bill?
gentlemen, we've really created, I think, a lot of wisdom for people to think about in this hour. Thank you very much, Robert.
My pleasure.
And thank you.
Thanks.
Don as well. You brought in some good points, and you
Yep.
also, Dwayne. This is, I hope our viewing audience has found this wisdom, and in some cases you can see it again on the same channel. So,
And our,
but,
and our hope is that you'll use this presentation to develop other dialogue
yeah,
with older people and younger people, community people, so that you can do what we just did, and that is to begin to raise the kinds of issues that are important to us, so that we can all work together to build a
Good.
better society.
now a DVD of this hour presentation is available.
Oh,
If someone wants to call the viewer response line and request one.
Okay.
You can also request a thumb drive that will just plug into a computer, and you can show it on that.
Well, what I would love to request is that when people respond to this presentation by doing their community discussions, that they also record those, and they could send them to us so that they can begin to, when I developed a clearinghouse on service learning, people want to know what other people are doing. What does this kind of discussion look like in rural Minnesota, in urban Minnesota? And if we can begin to collect that kind of information, we can help all of us to share with one another. So I would encourage and ask people, if you're watching this, please have a conversation. Please record it, and please contact Bill so that we can maybe find a way to make a collection of these conversations, so all of us can learn
And there's
from your collective wisdom.
your email address
Right.
on the screen too.
Sure, you can send an email
Send
to
it on
me,
to you.
and we can figure out a way to collect this kind of information.
Well, thank you all for listening.
Thank you.
It's been a great time.
Be well. Take care.